to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Pathway Patient Advocates is a private patient advocate company serving all 50 states as well as Canada. And in many states, private patient advocacy is a new concept, and many people really are not aware of what we do and how we can help and who we are. So I thought it would be a good idea to have some Q&As about once a month to really discuss what private patient advocacy is, how we can help in your situation. And I like to pick a topic every session to really kind of focus on. But our topic today is really about rare conditions. So one of the areas that I focus advocating for is patients with really rare conditions or even undiagnosed. That's an area or a topic that's very special to me because I really have an interest in patients with rare disorders or undiagnosed because I do really understand their struggles and they really do need a private advocate. So, a private patient advocate is different from a patient advocate that is often available complimentary through your healthcare provider or insurance company, etc. But I wanted to specifically address some letters that we've received today. So anytime you have, if you have something that you want us to share during the next upcoming Q&As, you can always send us a message via Instagram or you can email us as well. So whether you're going through health issues or a rare disorder yourself or you're seeking information for a family member or a loved one, you're definitely at the right place. And this topic is one that we've received quite a bit of messages about. So our first letter, we'll start with that, is from Norma. So Norma said, "Hi, my name is Norma. I'm 43 years old from Iowa." Hi, Norma. "I found out recently that I have cholangiocarcinoma. I've done a lot of tests and blood work, and they found out through my MRI that I have cholangiocarcinoma. I'm really devastated by this news as I'm still young and have kids to take care of. The doctor who diagnosed me with this informed me that surgery would not be an option. I think she's new to the hospital because she joined me having tests and we keep getting lost." Okay. Anyways, I continued insisting to hear about some options from the surgery team, but had no luck. Fast forward to today, and I want to explore some options. I know there are options and I don't want to lose hope. I have heard this type of cancer is rare and progresses very rapidly. Can you tell me more about private patient advocacy and how you can help with my condition?" So first of all, Norma, I'm very sorry to hear that. Thank you for sharing. I actually, it's difficult for me to read that because actually I have a family member that has cholangiocarcinoma, and fortunately, through many efforts, we are able to continue to work with him, and he's been managing it pretty well for the last 6 years, which is, not commonly heard. But yes, you're right. There are options. Getting a diagnosis like that is a very difficult one to hear, especially when it's a rare cancer like that. And you are correct. It's very fast paced. The good news is there's been a lot of advances in recent years on options for treatment as well as diagnosis. So there's some really great experts that really just specialize in cholangiocarcinoma, and I've really come to know some of them over the years. So I would, be very interested in reviewing your case, talking to you more to get some details, and really determining what additional considerations may be available for you. Please never hesitate to ask your questions to your healthcare provider, such as your doctor, regardless of whether they are an intern, an attending, an oncologist specialist. Ask your questions. If what you hear doesn't seem right, ask again and get more information and options. It may very well be that you're getting the same answer 2 or 3 times by by different healthcare providers, but that will just help you confirm that you're making the right decisions. But never, ever, ever feel nervous or apprehensive about asking a question. Healthcare providers each have their own way of practicing, and one doctor may have a different medication or a surgical technique that the other might not practice or might have not heard of. This is important when you're looking at a medical condition, but especially important when it comes to cancer. Nonetheless, a rare cancer or any rare condition. So we can definitely help you navigate and support you through this challenging journey. Thankfully, most recently, there have been wonderful advances in cholangiocarcinoma, and there are great resources available. Our next letter is from Louise. So Louise from Arizona said that she began experiencing a heavy menstrual bleeding and severe menstrual cramping with menstruation. She was seen for these symptoms by 3 pediatricians, a hematologist, oncologist, a gastroenterologist, a primary care doctor, and 4 OBGYNs. Okay. I was treated with a variety of progesterone-only oral contraceptive pills, which resulted in migraines, but still I didn't have control of my pain or bleeding. The only diagnosis I received was heavy menstrual bleeding, but I was told my symptoms were normal. I'm really suspicious of whether I have endometriosis, but after the evaluations of my doctor, they said that it was highly unlikely and it is very normal. To this day, I am in so much pain and help. I need help and a voice. How can you help me? Thank you for sharing that story. I'm so sorry that you are dealing with this difficulty, Louise. But definitely we can help you with this. We do have quite a few clients that have endometriosis, and that's one of those disorders that, while it's becoming more known of a diagnosis, it's very, very difficult to manage, and there's not that many experts that have kind of outside the box treatments and diagnostic tools available. And so our job as your advocate would be to help you get those resources and get that care that you need that may be difficult to achieve on your own or attain on your own. Our next letter is from Amelia. So Amelia said, my daughter Kate has been dependent on Ativan and after it was given to her in the hospital for insomnia, secondary to abdominal pain, and not being able to sleep. Ativan helped her symptoms, but after a few months, it got worse. She can't sleep, she had an episode of severe pain, and the worst is thoughts of suicide. We visited multiple psychiatrics specialists, but couldn't diagnose the cause of her symptoms. Then she slowly tapered off Ativan. The nightmares didn't end there, and she is having trouble controlling her body movements, it seems, and it's extremely painful to see my daughter getting through that. I know she needs help, and I want someone who can help me with this. I'm so sorry to hear that. You know, being a mother myself, I know that it's very difficult to watch your children go through something. And I really do, feel compassion towards you. And as a private patient advocate, my goal is to support you and Kate through this challenge. We don't just support the patient, we definitely support the family members and loved ones as well. One of the things that we can do is that we can work together and explore treatment options. We'll explore alternative treatment options and interventions that may alleviate Kate's symptoms. This could involve exploring different treatment options, as well as experts in psychiatry, neurology, and other relevant fields. We do have cases in the past that are similar to Kate's that we've been able to successfully really help achieve a better quality of life. I will work to ensure that Kate's voice is heard within the healthcare system, advocating for her needs and helping address any challenges or barriers to effectively improve her health and her overall care. And dealing with complex medical situations can be emotionally draining. I'm here to offer emotional support, guidance, and listening to you as you navigate through this difficult time. Together, we can work together toward finding the right help for Kate and improving her overall well-being. We have one more letter today from Robert. Robert was initially diagnosed with Parkinson's disease, and he has severe tremors, but eventually it affects his balance and movement, and he has undergone physical therapy to slowly cure this. However, as time went by, he had a problem with his breathing, even though, this is her father, sorry. This is from Mira. Mira is writing regarding her father, Robert. So Robert had some problems with breathing. Even though he stays at home, even just walking to the bathroom, he has a heavy breathing issue. He then saw his primary care doctor,